This is my presentation. It's vision and concussion. You won't be able to see my face, which is probably not a bad thing. But I just thought I'd give a presentation on vision and concussion and understanding the impacts and how to go about recovery. A little bit about myself. Uh, I had a very serious concussion in 2017 in the Waikato. At the time, that was playing rugby, and Waikato Rugby Union had implemented a system called the Blue Card, where I needed to go and check in with the local GP and undergo what's called a SCAT-5 test, which is a post-concussion test, to give a basement level of where I was at in terms of the concussion. Now, I was in Cambridge and I had to go to Hamilton. Obviously, I had to go after the concussion happened, sat on the sideline for a little bit to regather myself. I had to go and have a shower. I had to go home and grab some things because I was off to Pukekohe that evening, and then go check in Hamilton, sit in the waiting area for a little while. So probably an hour to an hour and a half after my concussion, I had the SCAT-5 test and passed. But all the same, we did a 3-week return to play protocol under the Blue Card. And I was quite lucky. I was, 4 years practicing optometrist. I'd been working with some colleagues at Patterson Burn Optometrists in Hamilton on developing behavioural vision protocols, and we were also trying to set up sports vision. So I had a lot of tools in my back pocket about visual training and moving the eyes and balance and coordination, as well as nutritionally looking at things through ketone science and that in terms of metabolic syndrome, also concussion and omega-3s. And going into playing rugby, I was in a ketogenic state, taking ketogenic supplements as well as omega-3 fatty acids, all to protect my brain from the effects of concussion. And I was doing lots of balancing and juggling and eye movements and things to try to be the best I could be at rugby. That was in order to help me understand what was going on in front of me, try and make faster decisions, be more accurate on the field, but also to try and mitigate things. But accidents happen. I ended up with a concussion. I still have effects of that today, but I mitigate those with good sleep, daylight sunshine, magnesium in the evenings, creatine and fish oil in the mornings, vitamin C, and yeah, just generally looking after myself, and those symptoms don't come about. So I understand that concussion can be a long journey, and over the last 4 or 5 years, I've seen plenty of post-concussion syndrome patients who are beyond that 3-month period post-concussion and things still aren't getting better, and have sort of formulated a comprehensive eye exam to try and understand where somebody is at in their concussion journey and see what tools we can do from a vision perspective to try and improve their being, their status, so that they can continue to heal and hopefully recover from their concussion and get back to the way of life that they hope to perceive. So that's sort of a little bit of a background. I guess added to that, in my Bachelor of Science, before getting into optometry, I did neuroscience, and so had big interest in brain anatomy, brain physiology, and also animal physiology, mostly connected to the brain. So yeah, that's a bit of my background. So today, we want to think about concussion as a traumatic brain injury impacting the brain function, including vision. We want to highlight that vision problems are common but often overlooked concussion symptoms, and we want to look at the key problems when it comes to vision and the vision system and concussion, its impact on vision, the common issues, and ways that we can recover. So concussion often disrupts the brain's visual processing centers. Common visual symptoms are blurry vision, double vision, or diplopia might be called, light sensitivity or photophobia it might be called, and difficulty focusing. We want to understand the link between the ways the eyes move and how that is controlled, and why post-concussion syndrome influences that. So the common visual problems are convergence insufficiency, so difficulty focusing on near objects or moving the eyes together correctly to the object at a close space. So sometimes people might end up converging too much and overshooting the object, getting double vision that way, or they're looking at an object in space, particularly close, and their eyes drift away. That'll often make blur, and if it drifts too far, then they'll get double vision as well. It affects our accommodation, so that's the muscle within our eyes' ability to focus. So we get accommodative dysfunction. So that's problem shifting the focusing of our eyes between near and far, and the accuracy of that focus. So we might be focusing in front or behind, the point of fixation again. We can get oculomotor dysfunction, so poor eye tracking, and that means that we have a big breakdown when we're trying to read. And we get vestibulo-ocular dysfunction, so a trouble with balance and motion sensitivity, how our eye motion and orientation connects to our vestibular system, our inner ear system, in terms of our balance, and also a little bit with our proprioception as well. We sort of feel like we're on a lean, where our body feels like we're upright, or our neck feels like we're upright. So when we sort of look at this, we want to think in terms of what are called the cranial nerves, and they are controlled in the brainstem. So the brainstem is like the body's central control tower. It connects the brain to the rest of the body. It manages important automatic functions like breathing, heart rate, and balance. Two key systems that help you see clearly and stay balanced are the oculomotor system, which controls the eyes, and the vestibular system, which is in the inner ear. And they work closely together through the brainstem. So how the oculomotor and vestibular systems work together. The oculomotor system controls how your eyes move, like focusing on a moving object or reading a line of text. The vestibular system, located in your inner ear, helps you sense movement and balance. It tells your brain if you're standing still, walking, or spinning. These two systems talk to each other through the brainstem. When they're working well together, you can stay steady and see clearly even if you move your head quickly. This is called the vestibulo-ocular reflex. Now, if you've been on a merry-go-round or a roller coaster or something that spins you, or your friend even better, if you watch them get off, their body will want to keep moving, and their eyes will end up with what's called a nystagmus. They'll sort of flick to the side and back to the middle, and flick to the side and back to the middle. And when it comes to professional dancers and ballerinas, that's what they're trying to control by fixing a point and spinning their head around and then ending up back in the same point. And that controls this vestibulo-ocular reflex. So what happens when we have a concussion? A concussion is a jolt or a blow to the head that causes the brain to shake inside the skull, which can disrupt the brainstem's communication lines. This can cause dizziness and balance issues because the vestibular system gets confused. Blurry or double vision because the oculomotor system can't control eye movements properly. And motion sensitivity because your eyes and your ears aren't working together, making things feel unstable or causing nausea. So why does this matter? Since the brainstem is critical for syncing eye movements and balance, damage from a concussion often causes visual symptoms and dizziness. This is why vision and balance tests, like the King-Divick test, which we'll get to, are so important for detecting concussions. And then so we get peripheral vision. So peripheral vision and binocular vision. Peripheral vision is what you see out the corners of your eyes. It helps with awareness of your surroundings and motion detection. Binocular vision means both eyes work together to create single 3D images with depth perception. Peripheral vision plays a key role by helping the brain align both eyes correctly for binocular vision. So how does peripheral vision support binocular vision? Peripheral cues help your brain position both eyes to point at the same object. The brain blends the images from each eye into one clear picture using input from both the central and peripheral fields. Peripheral vision reduces strain by helping your eyes work together effortlessly, especially when tracking moving objects or navigating spaces. Your brain is sort of running both your peripheral vision and your central vision all at once, and your peripheral vision is leading where your central vision is going to go to next. So what happens when you have a concussion? A concussion can disrupt the visual processing in the brainstem and occipital lobe, which is where the visual processing center is, at the back of your head. And this can cause tunnel vision, which is a loss of that peripheral vision, forcing you to rely on your central vision. And so your central vision is sort of acting with no sort of idea where it's going to go to next, as I was saying before. Last year, with a couple of concussion patients I had here, we had complete physiological double tunnel vision. So I was doing visual field and I repeated those visual fields. I tried it also with the right eye first and the left eye second, and the left eye first and the right eye second, to see how fatigue would impact things. And also when we repeated the visual field, it was a week later, without having the impact of all my concussion workup before the visual field. And even so, these people still had really tight tunnel vision. And so that was affecting their awareness and orientation and all those things, because they weren't considering their peripheral vision and their eyes were sort of wandering. And then it was also resulting in this, which is a binocular dissociation, when both eyes stop working together properly. Without peripheral guidance, your brain struggles to merge the two images, causing double vision, diplopia, because each eye sends a separate image, and you get eye strain, headaches, and difficulty focusing. So this sort of touches on what I was saying just before. Why does this tunnel vision make double vision worse? With the limited peripheral vision, your brain can't align both eyes correctly. Your eyes may wander out of sync, increasing binocular dysfunction, and this leads to overlapping or ghosted images, which is a classic sign of double vision. And how does this cause dizziness? By disrupting the vestibular system. So visual dissociation happens when your eyes stop working together to create a single stable image, and this can cause symptoms of double vision, blurry vision, and difficulty focusing. And how the vestibular system and the vision system work together: the vestibular system in your inner ear detects the head movements, sends signals to the brain about the balance and spatial orientation. Your eyes send visual information about your surroundings. The brain stem coordinates both systems through the vestibulo-ocular reflex, we talked about that before, that spinning effect, to keep your vision stable while you move. When you turn your head, your eyes automatically adjust, so your vision stays steady. So what happens during visual dissociation from a concussion? A concussion can cause the eyes and inner ears to fall out of sync, creating a sensory mismatch. That means you're getting conflicting signals. Your vestibular system says you're still, but your eyes say you're moving, or the other way around. Your eyes say you're still, but your vestibular system has flow and feels like you're moving. And then the brain gets confused. The brainstem struggles to merge these signals, causing a feeling of instability or spinning, dizziness. And so the loss of this vestibulo-ocular reflex stability means that you've got poor eye control, and your vision may bounce or blur with movement. And that's called oscillopsia. Let's say it again, oscillopsia. And so why does that cause increased dizziness? You get peripheral vision loss, which reduces spatial awareness, making you balance harder. You get double vision, which confuses the brain senses of position. And you have increased eye strain, which further disrupts that vestibulo-ocular reflex, worsening those balance issues. So then we need to think about the focusing system of the eye, and that's driven by the sympathetic versus the parasympathetic tone. And this is also true for your pupils. The parasympathetic nervous system supports your convergence and your eye's ability to focus. It also constricts your pupils to give you a bigger depth of focus, which is a bit more of a margin of error, especially up close. Whereas the sympathetic tone, the fight or flight system, dominates post-concussion, and then that weakens that ability to bring the eyes together, for the eyes to engage in focusing, and like I said, for the pupils to constrict. So we shine a light in people's eye post-concussion, which is not nice for them because they're photophobic, but even though they're sore and painful and it hurts, their pupils constrict momentarily, sometimes only for 1 or 2 seconds, before releasing. That sympathetic tone takes over and dilates the pupil again. Think about your cat when it's scared and it's got those massive dinner plate eyes. And so that means that it's even harder to focus on things, because you've not only got the inability to hold focusing in the eye, but you've also got a narrower depth of focus. And we commonly see this in people who are long-sighted, not necessarily to a large extent, even though they should have enough focusing effect left in their eyes, go from being able to see clearly in the distance very easily to not having enough focus to compensate and having blurred distance vision. And also prior to the concussion, they may not have had reading issues, but all of a sudden these become manifest because not only has their lens lost flexibility with time, but also they no longer have that engaging, focusing effect of the muscles to change the lens size, so they can no longer read. But we'll get to that later. So when it comes to concussion and doing activities that put us at risk for concussion, understanding whether or not someone has had a concussion early, and meaning that they don't then receive another concussion or more injury. Both those things, of course, increase in risk once you've had one concussion. It's important to have baseline tests. So one of the key screening measures is the King-Devic test. It's a rapid screening tool used to assess eye movements and detect potential concussions, especially in sports settings. It evaluates visual tracking and cognitive function, which are often impaired after a concussion. The test involves reading aloud a series of numbers displayed on cards or a digital screen as quickly and accurately as possible. Excuse me. The numbers are arranged in different patterns and require quick eye movements, which are called saccades, to follow. The test measures both speed and accuracy, recording the total time taken to complete all cards. Now, it's good to do this in pre-season and make it quite competitive so that your athletes are performing this as best they can, so they have the best score possible, so that the test is even more sensitive should they have a head knock in sport. And this probably goes for horse riders and motocross riders, basketball players, anything that's high velocity where you might have a head knock that could cause a concussion. This is a great thing. So concussions often impair the saccadic eye movements, which are those rapid eye movements from one point to another, and reduce cognitive processing speed. A slower time or more errors compared to the athlete's baseline test indicates a possible concussion. So the key features here are the baseline test. So you typically conduct those in pre-season for athletes to establish a normal score. And as I was saying, you want that to be quite competitive in their environment so they do well, so it's a more sensitive test. Post-injury test is administered immediately after a suspected head injury to detect changes, and it's quite easy because it's quick and portable. It takes about 2 minutes to be administered on the sidelines, and you can use it on a tablet or have it printed out on cards. Studies have shown the King-Devic test is a reliable indicator of concussion, and it correlates to other neurological assessments. It's often used alongside other tools like the SCAT-5, which I spoke about when I was on the blue card, for a comprehensive concussion evaluation. So in behavioural optometry, and also when it comes to post-concussion syndrome, we may use another test called the developmental eye movement test, which is slightly different. They are both assessing eye movements, but they differ in the purpose of them and the structure of them and where they're used in clinic. So the King-Devic is primarily used for concussion screening and detecting impaired saccadic eye movements due to brain injury. The dynamic eye movement test is used to evaluate reading-related visual issues such as oculomotor dysfunction, which is problems with eye tracking, and automaticity, which is number naming speed. So as we talked about, the King-Devic is a row of numbers and focuses on visual scanning speed, those eye movements and cognitive function, and you're looking at the total time and the errors, and it's typically used for athletes for post-concussion assessments or post-head injury assessments to see whether they've got concussion. Whereas the dynamic eye movement test consists of vertical and horizontal number reading tasks. I should have bought a chart for those watching on Instagram, and I should put one in the slides, so I must note that down. And it has a vertical test which tests that automaticity, that ability to name them and recognize them, and then it has this big chaos of horizontal numbers that are spaced differently, and so that tests that automaticity, but also the oculomotor control, so the ability to move along the line without error and without getting lost down the page. So it provides the separate vertical, horizontal, and ratio score, and it allows you to identify problems with visual or cognitive function. It's often used in vision therapy, as I said, after someone's had post-concussion syndrome to try and see their improvement in their reading ability. In educational settings, so again, trying to deal with kids that are having trouble with reading because of behavioural vision problems, or in dyslexia. Excuse me, I'm just going to have a drink. Now, obviously, dyslexia can't be fixed by behavioural vision problems, but if you fix behavioural vision problems, a dyslexic person will have a better time. And so, yeah, the King-Devitt is more a brain trauma test, whereas the dynamic eye movement test is more sensitive for functional visual skills, reading difficulties. Optometrists, vision therapists, and educators would use that, whereas sports trainers, coaches, and concussion clinics would have the King-Devitt. So let's get on to vision therapy for concussion recovery. We want to retrain the brain coordination centers through targeted exercises. And in the case of optometry, we're using the eyes. In the case of physiotherapy, they're using the vestibular system and the proprioception system, so balance and touch. And in optometry, we'll often incorporate those two, look at the midline, look at body awareness, just to really hone in on tuning that brain stem. So there's a lot of crossover with behavioral optometry and what is done in physiotherapy and occupational therapy. So yeah, you may recognize some of these drills from physiotherapy, but we are sort of looking at the way the eyes are moving as a whole. So their posture, their reserve or their fuel in the tank, and then also the focus as well. So we can use prisms to move the light or to strain the eye movements. We can use filters to dull the light, and that just makes things nicer. Eye exercises, we can use plus lenses to make up for that lack of focusing, and we can also use plus and minus lenses to build flexibility or sort of eye press-ups of that focusing system, and then we can also use specialized lenses in your prescriptions. So what we've got here, you won't be able to see this in Instagram Live, but what we've got in the slides is the Brock's string test. Now, it says they're focusing near, focusing middle, focusing far. It is also converging near, converging middle, converging far. So that's where the Brock's string test is really, really good. The point that you're looking at should also match where you're focusing at. So if you're in focus, say, on that middle bead, you should see the string that those three beads are along cross over in the middle of the bead. And you know that your convergence is lagging if you're seeing the string cross behind the bead that you're looking at. Vice versa, if you're over converging, you'll see the string cross in front of the bead that you're looking at. And this can be used in a number of ways to sort of match focus and eye movements to get the really good feedback. If you got binocular vision problems and one of your eyes goes wandering, you'll end up with a straight line with the three beads along it, and you'll lose that crossover effect of it looking like there's two strings. So this is really good. What's really important is that you're wearing the correct visual correction, especially if you're older. To try and be focusing up close will be difficult if you're not wearing reading glasses. And you also need to work within a tighter depth there, because especially towards higher reading editions, like into sort of 175 and above, you don't have much depth of focus anymore. Not to mention that the focusing muscles in the eye of post-concussion aren't working that well. So there's a little bit to consider when it comes to the Brock string. So prisms can be used in two ways. We've got relieving prisms, which we often will grind into the glasses. These can often need to be larger up close to allow for those convergence movements of the eyes. And they just aim to sort of be like crutches and reduce the load so that you can cognitively recover and get over this post-concussion syndrome. And then we have training prisms, which is used in visual therapy. Often you can take the likes of these flippers home. This is my stepdaughter, Annie, and Annie actually is wearing glasses to correct her long-sightedness. She doesn't have a full prescription, and so it's difficult to see in this photo, but Annie's right eye is actually turned in here, even though I've got 8 base in prisms. And that's because these 8 base in prisms are too strong for her, and that's what we would actually be using a much lesser prism base in to try and train her reserves, her fuel in the tank for eye movements out, because she can very easily move her eyes in, especially in the glasses she's wearing, which aren't her full manifest prescription. She's +4 and she's wearing about a +2. So this was a very hard task for her. It's just a bit of a shame that picture doesn't show it. But like any training task, we're trying to extend the eye's capability so that in normal function you've got plenty in reserve, and again you can recover better. You can get through the day without being knackered. And then we've got lens flippers. Annie, being young, is awesome at flipper tasks. She can accommodate all the way to her nose. She's accommodating +2 all the time through her glasses, no problem at all. And these just really sort of help the eyes to loosen up. Often somebody's focus is quite rigid post-concussion, and prism flippers allow the eyes to get basically in some press-ups and improve their capacity to change the shape of that lens. So people who still have flexibility in their lens can harness that, and like we said at the start about people who are alongside of that can no longer see at distance, we hope them to be able to see in distance clearly again and easily again, and also be able to read easily again. They may still need an add if they're over 45, but like we said, get them at least back some of the way to their capacity from before. And like I just said, we can put ads in glasses. So often post-concussion, that can be reading glasses or bifocal glasses, and we'll get on to why not necessarily a progressive lens when someone's had a concussion, especially early on. So here we go. Why the progressive lenses can be a problem. So progressive addition lenses, or PROGs or progressives, they're commonly used for presbyopia, which is that loss of flexibility within the lens of everybody's eye. That tends to start about 45, and they're a multi-distance vision correction, and they can create significant challenges for individuals recovering from a concussion. Now, peripheral defocus and visual distortion is probably a big one. They provide a gradual change in lens power, resulting in areas of peripheral distortion. So for concussion patients who often experience tunnel vision or reduced peripheral awareness, these distortions exacerbate the visual discomfort, disorientation, and dizziness. The brain, already struggling with processing spatial information, becomes overwhelmed by the blurred peripheral images. So that one makes a lot of sense. Binocular vision and eye teaming issues. Concussion frequently disrupts binocular coordination, leading to eye teaming difficulties and double vision. Progressives complicate this by forcing the eyes to navigate through different power zones, causing misalignment and visual strain. This can increase the risk of binocular dissociation, where each eye processes images independently, compounding issues like double vision. So again, with that periphery as well, if one eye wanders, that's going to wander into the blurry zone. That's going to catch your attention, that vision is blurry. Meanwhile, your other eye's wandering off as well. And so you just creates big issues, or can. Number 3, increased visual effort and cognitive load. So the design of progressives requires precise eye and head movements to locate the correct focal zone. So you probably need to have your head straight on, looking through the upper part of the lens for distance, and looking down through the lower part for near, and somewhere in between for intermediate. Concussion sufferers often have impaired oculomotor functions and difficulty with visual tracking. This constant adjustment needed to use the progressive properly increases visual effort and cognitive load, often triggering symptoms such as headaches, nausea, and dizziness. So that's where we're talking about that we're probably better off having some single vision lenses. Now these are tools to help you recover from the concussion. Hopefully we can get to a position where you can use something more practical like a progressive lens, but at first it might mean having these 3 pairs of lenses if you're presbyopic and you've got no real focus left. So we need that focal plane for near, focal plane for intermediate, and focal plane for distance. The beauty of it is that the whole lens is in this visual plane. It's a clear visual field without peripheral distortion, and it's ideal for reducing strain in patients with limited visual flexibility. And we can also put the accurate prism in that for that working distance. As I said before, bifocals or task-specific lenses, so they offer a distance or intermediate zone, and then a near vision zone without the gradual transition issues of the progressive. And like I said, relieving prisms or these additions in the lenses. So they help with convergence and insufficiency and accommodative dysfunction, which is common, as we talked about. So while the progressives are effective for age-related vision issues, which is presbyopia, their peripheral defocus, eye teaming disruption, and increased visual effort make them a poor choice for concussion patients. Single vision or task-specific lenses combined with targeted vision therapy greatly reduce the symptoms and support a smoother recovery from post-concussion visual dysfunction. So, yeah, that's what I wish ACC understood, is that these are the tools to help someone recover and get back to normal life, and normal life looks like being able to use a progressive lens again. Oh, gone the wrong way, have I? I know. Protective eyewear and concussion prevention. So, obviously we want to protect the eyes, shooters, motorcyclists, horse riders. Are you wearing protective eyewear to avoid damaging the eyes? Working with one eye is very difficult, increases the risks for concussions. And are we doing things to prepare ourselves for a concussion? So in my podcast, I was lucky enough to talk to, of Michael Lewis, Dr. Michael Lewis, who worked with the US military. And some fascinating data they got out of the Gulf Wars was that the US military was low in omega-3 as it was, and by supplementing the military with omega-3s, they reduced the risk to their soldiers for blast concussions. So if you fire a weapon, the forces of that, or you're in a vehicle that's hit by a weapon, the forces and whiplash of that ultimately can result in concussion. And just simply by supplementing the military, they reduced the number of concussions from these events, which was quite interesting. So Michael was a keen advocate for anybody playing high velocity sport to be taking fish oil. When they had someone get a concussion, they found that if they further supplemented with fish oil, then they recovered better, and that also reduced the risks of post-traumatic stress disorder within the soldiers. So yeah, I've got quite an interesting conversation with Michael Lewis on my podcast, The Stag Roar, if you wanted to go and look at that. When it comes to post-concussion, making sure we're getting good sleep, we're trying to orientate ourselves to circadian rhythms, so trying to get up in the morning, is get that early morning sun, getting that midday bright sun, and that evening sun as well. So being outside on those key points of the day, trying to keep a real sort of pattern of sleep and awake. We can use things like magnesium or ashwagandha to help us wind down, getting in a really good routine in the evenings, whether that's having a cup of tea like I am, winding down, probably not shining bright lights in your eyes like I am. But yeah, just that real good behavior. Trying to move our bodies, obviously it can be difficult. We need to be safe in the way that we move our bodies. Had a friend who fell off his bike in a Ironman, and he couldn't even sit on a stationary bike, let alone a treadmill. But just working up to that activity, they found, I think it's the British Medical Journal of Sports, that trying to get the blood flow definitely helps the return to play. And so return to play protocols or return to work protocols shouldn't be inhibitive of activity, and actually as much activity as you can manage is going to speed up the recovery. So that's also important. Slightly controversial, but CBD oil has been shown to have an effect with concussion, and especially for those people with chronic concussion. We're talking well and truly over that 3-month mark, having discussions with general practitioners and potentially your case manager about looking into supplementing with CBD oil, non-psychoactive from the hemp plant or the cannabis plant, that can be helpful to people with post-concussion syndrome, although not widely used in New Zealand. That is also part of the protocol that Dr. Michael Lewis spoke about with the US military, again helping people recover from post-concussion syndrome and traumatic brain injuries, and preventing post-traumatic depressive disorders. Yeah, goodness me, too many words. So Yeah, lots of things to consider. Optometry is just one part of the gradual recovery that is post-concussion. We have tools that can help with post-concussion, but definitely not. Optometry is not a panacea. It will not solve all of the dizziness and things, but it will help you to grow and recover and heal so that you yourself can handle those things. So that's what I'd sort of put out there when it comes to optometry. So in summary, the visual issues post-concussion are common, but manageable with proper care. It'd be great if you're in a high-velocity sport that you've got some screenings in place, and that therapy happens quickly. So you're getting a SCAT5. Hopefully physiotherapists and general practitioners who are seeing people on those Saturdays have those tests available, and that's becoming common so that we can have something to work through as you recover. Like I said, that recovery is often within the first 3 weeks or so. If you're starting to get out to that 3-month period, you really need to be engaged with ACC and have a case manager and working through these specialties that deal with concussion to try and get you back to work or back to your sport or just back to life. And of course, preventing concussion, whether that be with awareness of your body, working on balance, making sure that there's no underlying binocular vision disorders that mean you're more at risk of getting a concussion. So having an eye exam are all great things that can help prevent that. And like we said, nutrition and sleep and things also help to buffer the system. So I don't know if I'm able to do any questions because I don't think I can get out of the screen share.